Vitaphone's mission is to produce and use innovative telemedicine strategies and devices that help all the healthcare stakeholders, the providers, patients, and their families, to have access to much more actionable data so that they can make more informed decisions.
We utilize devices to monitor patients in their home setting, and then we engage patients to help them better understand their disease process.
The devices transmit by Bluetooth to the hub, and the hub transmits by the cell phone network back to our servers, and then the information is presented to our nurses and other assistants who triage that data and filter that data and respond to it per protocol.
So we monitor the data that comes in here in the center, and we call the patients if they have alerts. We have several different chronic disease management programs, and so the client has the ability to pick and choose which devices to deploy to the home for each patient.
We're about enabling the providers to extend their reach into the home through technologies so that we can understand what's happening with the patient, so that the patient then can feel better. They can live their life as they want to live their life.
There are a lot of companies that collect data, and they do a data dump of information to a healthcare provider. There's a lot of erroneous data that comes through. The healthcare provider doesn't have time or the need to see that. They want the relevant data for their patient. We do a very good job at filtering that data and putting it in a usable form for that healthcare provider.
Having access to data in near real time is really important. Oftentimes, patients will start to feel worse, and that will progress over days. They may not realize exactly what's going on with themselves, and then finally they'll present to an emergency room in 5 days or in a week, and you realize it's something that if we had had access to information telling us that the patient was decompensating, someone could have stepped in, could have brought them into a clinic, and we could have helped the patient, help them feel better. They didn't have to get to that extent. If a provider is interested in exploring telemedicine, I welcome their call. We can design solutions specifically for them, specifically for their conditions. That might involve telephone outreach from our telemedicine service center. That might involve specific devices that obtain biometric signals from the patients, and might even involve education of the patient regarding a condition. So there's a wide variety of ways to implement telemedicine, and we encourage folks to give us a call to start that conversation.